Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Lybalvi Olanzapine and Samidorphan, oral. Lybalvi raises the risk of death in older individuals, aged 65 and above, with psychosis due to dementia. For this reason, it is not approved for treating dementia-related psychosis. /r/n/n/n Lybalvi is a combination prescription medication that contains two medicines, olanzapine and samidorphan. /r/n/n Olanzapine is an atypical antipsychotic, while samidorphan is an opioid antagonist. Olanzapine blocks the activity of two naturally occurring brain chemicals, dopamine and serotonin. Samidorphan blocks opioid receptors with some agonist, binding, activity at kappa and deltaopioid receptors. /r/n/r/n Lybalvi is used only in adults to treat. /r/n/r/n Lybalvi is not to be used in individuals with dementia-related psychosis, as it increases their risk of death. /r/n/r/n This medication is available by prescription only. It comes in tablet form, which is taken by mouth. /r/n/r/n NameOlanzapine and Samidorphan /r/n/r/n NamesLybalvi /r/n/r/n Drug availability, prescription /r/n/r/n administration RouteOralrnrn/r/n/Therapeutic Classification Antipsychotic and opioid antagonist /r/n/r/n/Available generically /r/n/r/n Controlled substance/a/r/n/r/n Active IngredientOlanzapine and Samidorphan LmalaternrnDosage Dosage forms tablet /r/n/r/n Lybalvi is used in adults for the treatment of /r/n/r/n Take your medication exactly as prescribed by your healthcare provider. /r/n/r/n Take Lybalvi by mouth once daily, with or without food. Swallow the tablets whole. Do not split or crush them. Do not mix different strengths of the dosages. Your healthcare provider may start you on a low dose and gradually increase it. /r/n/r/n Contact your healthcare provider before changing the dose or stopping Lybalvi. /r/n/r/n Store Lybzalvi in its original bottle at room temperature, between 68°F and 77°F. Keep in a dry place with the bottle tightly closed. Leave the desiccant pack in the bottle to protect it from moisture. Keep away and out of reach from children and pets to prevent accidental consumption. /r/n/r/n Lybalvi may start working in the body as soon as you start treatment, but you may not notice improvements for several weeks. In clinical trials, treatment with olanzapine and samidorphan significantly improved schizophrenia symptoms compared with placebo, inactive sugar pill, at 4 weeks after starting it. In another study, treatment of olanzapine and samidorphan showed similar improvements at 24 weeks. /r/n/r/n This is not a complete list of side effects, and others may occur. A healthcare provider can advise you on side effects. If you experience other effects, contact your pharmacist or a healthcare provider. You may report side effects to the Food and Drug Administration, FDA, at www.fda.gov/medwatch or 800 FDA 1088. /r/n/r/n You may experience some side effects with Lybalvi. Common side effects reported with this medication include /r/n/r/n Lybalvi has a boxed warning, the strictest safety-related warning assigned by the FDA for a medication. Older adults, 65 years and older, with dementia-related psychosis associated with the use of antipsychotic drugs are at an increased risk for death. Lybalvi should not be prescribed for use in this population. /r/n/r/n Other potentially severe side effects are possible with this medication. Notify your healthcare provider immediately if you have serious side effects. Call 911 if your symptoms feel life-threatening or if you think you're having a medical emergency. Serious side effects and their symptoms can include the following: /r/n/r/n Lybalvi may also affect blood cell counts, including /r/n/r/n based on your medical history. Your healthcare provider may monitor your white blood cell count. Sometimes, stopping treatment with Lybalvi is necessary if white blood cell counts drop too low. /r/n/r/n tardive dyskinesia, characterized by involuntary movements, may start or continue even after stopping treatment. /r/n/r/n Lybalvi may cause other side effects. Call your healthcare provider if you have any unusual problems while taking this medication. /r/n/r/n if you experience a serious side effect, you or your healthcare provider may send a report to the FDA's MedWatch Adverse Event Reporting Program or by phone, 800-332-1088. /r/n/r/n forms and strengths /r/n/r/n Lybalvi comes as a tablet that you swallow in 4 different strengths. /r/n/r/n you will probably begin with a starting dose of Lybalvi, which is generally taken once daily. Your healthcare provider may adjust this dose over time until you reach the recommended dose for your condition. The recommended dose will treat your condition while causing minimal side effects. /r/n/r/n recommended dosage, /r/n/r/n in some individuals, the body may handle Lybalvi differently. For this reason, your healthcare provider may choose to discontinue your Lybalvi or modify your dosage depending on certain factors. /r/n/r/n pregnancy /r/n/r/n newborns exposed to this medication during the 3rd trimester of pregnancy may develop extrapyramidal, drug-induced movements, or withdrawal symptoms after birth. /r/n/r/n contact your healthcare provider if you're pregnant or plan to become pregnant. A pregnancy exposure registry monitors pregnancy outcomes in people exposed to atypical antipsychotics, including Lybalvi, during pregnancy. Your healthcare provider may ask you to enroll if you take Lybalvi while pregnant. /r/n/r/n lactation /r/n/r/n Olanzapine, one of the ingredients in Lybalvi, crosses through breast milk, which may be toxic for the infant. There is no data on the presence of Lybalvi in human milk, the effects on the breastfed infant, or milk production. Talk to your healthcare provider about breastfeeding while taking this medication. Watch for symptoms of excess sedation, irritability, poor feeding, and tremors or abnormal muscle movements in breastfed infants. /r/n/r/n advanced stage /r/n/r/n healthcare providers may prescribe a lower dosage of Lybalvi to older people who may have decreased clearance or respond differently to the drug. /r/n/r/n those with dementia-related psychosis treated with Lybalvi are at an increased risk of death and, thus, should not be prescribed Lybalvi. /r/n/r/n liver or kidney impairment /r/n/r/n no dose adjustment is necessary for people with mild or moderate liver or kidney impairment. However, this medication is not recommended for those with end-stage renal disease. Let your healthcare provider know if you have a history of liver or kidney problems. /r/n/r/n if you forget to take a dose of your medication, do not panic. You can take the missed dose on the same day unless it is too close to the time of your next dose. If it is too close to the next dose, within 12 hours, skip the missed dose. Resume the regular dosing schedule the following day. /r/n/r/n do not take extra to make up for the missed dose. Call your healthcare provider or pharmacist if you need help. /r/n/r/n taking too much Lybalvi can lead to serious harm and may require hospital admission. If you've taken more of your medication than prescribed, immediately contact your healthcare provider or poison control for medical guidance. /r/n/r/n overdose symptoms related to olanzapine, a component of Lybalvi, have included /r/n/r/n. If you think you or someone else may have overdosed on Lybalvi, call a healthcare provider or the Poison Control Center, 800-222-1222. /r/n/r/n. If someone collapses or isn't breathing after taking Lybalvi, call 911 immediately. /r/n/r/n. Do not take Lybalvi if /r/n/r/n Lybalvi can interact with other drugs. Before starting treatment, tell your healthcare provider about all medications, including prescription and over-the-counter, OTC, drugs, vitamins, or herbal supplements you take. /r/n/r/n. Types of drugs that can interact with Lybalvi include /r/n/r/n. Talk with your pharmacist or healthcare provider for more detailed information about medication interactions with Lybalvi. /r/n/r/n. Other medications used to treat both schizophrenia and bipolar disorder include /r/n/r/n Olanzapine /r/n/r/n Zyprexa. Olanzapine is an antipsychotic prescribed for schizophrenia or bipolar disorder. It is available as a tablet or an orally disintegrating tablet that easily dissolves in your saliva. It is also available as an injection under a special program for treating acute agitation associated with schizophrenia and bipolar mania. /r/n/r/n. Treatment with olanzapine alone is associated with more weight gain than treatment with combined olanzapine and samidorphan. /r/n/r/n. Cariprazine /r/n/r/n Vrela is an antipsychotic used to treat schizophrenia and certain forms of bipolar disorder in adults. Vrela may cause uncontrolled movements in your face, tongue, or other body parts, a condition known as tardive dyskinesia. Sometimes, it can start or continue to last after Vrela has been stopped. /r/n/r/n Aripiprazole /r/n/r/n Aripiprazole is an orally prescribed prescription medication used to treat many psychiatric and neurological disorders, including schizophrenia, bipolar disorder, irritability associated with autism, and other conditions in people 6 years and older. It is also available in other formulations, like oral disintegrating tablets and as a liquid suspension, making it a suitable option for children. /r/n/r/n. This is a list of drugs also prescribed for schizophrenia and bipolar disorder. It is not a list of drugs recommended to take with Lybalvi. In fact, you should not take these drugs together. Talk to your pharmacist or a healthcare provider if you have questions. /r/n/r/n. This medication has a boxed warning, the highest safety-related warning assigned by the FDA to a drug label. The boxed warning states that Lybalvi increases the risk of death in older people with confusion and memory loss, dementia. Therefore, it is not approved for treating dementia-related psychosis. /r/n/r/n. You should not start Lybalvi for at least 1 to 2 weeks after stopping opioid treatment, depending on whether you were taking short or long-acting opioids. Do not use opioids while you are on Lybalvi. /r/n/r/n Lybalvi may also interact with the following types of medications: /r/n/r/n strong CYP3A4 inducers /r/n/r/n strong CYP1A2 inhibitors /r/n/r/n CYP1A2 inducers /r/n/r/n diazepam, alcohol, or drugs that affect the central nervous system /r/n/r/n anticholinergic drugs /r/n/r/n antihypertensive agents /r/n/r/n levodopa-dopamine agonists /r/n/r/n. Talk to your healthcare provider or pharmacist for more detailed information on drugs drug interactions./r/n/r/n studies have shown that Lybalvi causes less weight gain and a smaller increase in waist circumference compared with olanzapine alone. However, weight gain is still the most common adverse event with this drug. You should monitor your weight before and during Lybalvi. Samidorphan appears to reduce olanzapine-induced weight gain. /r/n/r/n A mental health condition like schizophrenia or bipolar disorder can affect your daily functioning. While living with a mental health condition can be challenging, coping strategies, such as these, can help. /r/n/r/n Be patient. Do not stop this medication without talking to your healthcare provider. It may take a few weeks before you see your symptoms improve, and stopping suddenly may have harmful effects. /r/n/r/n If you forget to take your doses, consider using your cell phone or smart devices to set up reminders. /r/n/r/n Very well, health drug information is meant for educational purposes only and is not intended to replace medical advice, diagnosis, or treatment from a healthcare provider. Consult your healthcare provider before taking any new medication. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.